Hello, I would like to invite you to go on a hike with me. Then let's be honest, we spend too much time in front of our computer and on our couch, so we decided to be active. Picture this, we're on the beautiful Swiss mountains and want to go on top of the mountain. So the sun is shining, it's not too hot, not too cold, so perfect condition. We take our backpack and start hiking. But after a few hundred meters you feel a terrible pain in your knee. It feels like someone is stabbing you with a knife right into your knee joint. You're afraid of doing any damage, so we abort this mission and go home. You consult your doctor, and after an examination and listening to your story, you receive the diagnosis knee osteoarthritis. You will also get some painkillers and the advice to stay physically active. At home you think, what does it mean to stay physically active? And what do I have to do? And do I have to take painkillers all my life now? My name is Lea. I'm a physiotherapist and a researcher. And I was looking at exactly this problem. So we wanted to improve the conservative management of knee osteoarthritis in Switzerland, meaning the time between the diagnosis and a possible surgery. We know that the guidelines recommend exercise, education, so good knowledge about the diagnosis, what to do and what not to do, and weight reduction if needed for conservative management of knee osteoarthritis. But we found out that only around 54% of the patients are referred to specific exercise. Other countries had a similar problem, so they developed an exercise and education program to translate those guidelines into practice. We analyzed those programs and found one that was most suitable for the Swiss healthcare setting. So we wanted to implement the program into Switzerland. But how do we implement the program? Do we just start running it and think that it's going to be successful? We figured that we need support. So we invited important people in the conservative management of knee osteoarthritis to discuss barriers and facilitators for such a program. Now we have the support from important medical doctor societies, physiotherapy societies, and patients' organizations who support the program. The program started, but how do we know that it's really successfully implemented in Switzerland? So we will evaluate the implementation success by looking at how well is it accepted, is it well adopted in usual care, and other important factors. And with this structured implementation process I just described, we hopefully improve the conservative management of knee osteoarthritis in Switzerland, so people will have the knowledge and the tool to prepare themselves to go on that hike with me again on top of the mountain. Thank you for listening.